to give people a chance to kind of tune in,
Uh-huh.
and then we'll get into the meat of it.
Got you.
Yes. So you've been ripping and running, huh?
Yeah.
But you
Tight.
made it a point to get stationaries so you could make sure your people got what they need. My people
Oh yeah.
too.
Oh yeah.
Yeah.
You know, when they put this out, it spread like wildfire. You know, everybody was sending text messages. I think I got like 10 text messages where put your order in right now. I'm I mean, I'm not complaining about that because that's just letting me know that a lot of people are really paying attention to it now. And
Yeah, that's a good thing, right?
yeah, oh yeah, and every day that you watch the news or listen to someone, you get 3, 4 questions, you know,
Hmm.
um, because they saying that it'll be gone this year.
You talking about this year. I'm telling you what I believe.
Uh-huh.
I believe this site is probably going to crash real soon. So we're here because we just trying to help get the word out for people. And the whole thing with testing for me is this. Before I even contracted COVID, Dr. EJ, our Dr. EJ, I call her the doctor next door,
Uh-huh.
sent me the link to get the Benax Now tests that were at Walmart at the time. A double test kit, 2 tests in one package, were $14. They had a limit. You could only order 6 per household, right? And you could order 6 every day if you wanted to. I opened it up, I started my order, and I never finished it. And then shortly thereafter, I contracted COVID. So I thought, well, it's less
Wow.
relevant, but I still want to get them because I could be testing people who are coming into my house, or I could do it later down the line. I said, I'm not worried about it. I'll do it later. Those same test kits now are no longer available.
Uh-huh.
And the places where they are available, it's $50.
See, and that's the problem. People start price gouging, and it seems to be a problem when they get the price gouging like that. So
Yeah,
I'm
but
like, man,
that's the nature of our capitalistic economy, right? Like, if people can charge more, they do. And so this opportunity, I think, is so important for people. And I know a lot of people got word, but what I'm trying to tell people is just do it now. Don't wait. The site is still up and running. I literally, right before I hopped on with you, was on with a good friend in Baltimore
mhm.
who thought she had COVID. Turned out she didn't have COVID. She might have had the flu or just a cold. And we had the most terrible time trying to find a community site for her to get a rapid test. It was
Uh,
just awful. So she ended up having to make an appointment for 2 days later to get a PCR test. And then she had to wait not that long. Actually, she only had to wait about a day to get her PCR test results back. But in that time period, she was at home. She wasn't able to work. And she just had to deal with the worry of not knowing. So having these test kits, I believe, will be great for people because you'll have
so
the
so so
right
Dr.
in your
Furr-Holden,
hand.
we're gonna hold that part up because that was gonna be, like, hey, we coming straight at them with why it is so important to order this test kit. Why did they even send them to? Why are they sending them to the house? And different things like that. But hey, listen, Facebook fam, please share this. Dr. Furr-Holden, I guess she likes my company or something. I don't know. No, I'm just joking. I'm just joking. I'm just joking. It's fun in a way of being able to sit back and chat with everyone, and really let everybody know how important um, it is to get reliable information about COVID. Because I mean, I'm watching and they still talking about we haven't even reached the surge yet. So, it's kind of scary to me because they're saying that it's going to be more deaths behind this. So, me and Dr. Furr-Holden was talking, and I was like, hey, you know what? We don't even hear anybody talking. So she and I just said, forget it, hey, let's come on. And I really appreciate Dr. Furr-Holden, man. I mean, she didn't have to take the time out. I be calling her, hey, Dr. Furr-Holden, what you doing? Hey, listen, I got another question. All right. Uh, okay, that's a good question. All right. Let's go and let's go live so we can tell the people. I mean, but it's good being able to have someone that we can call on, and she's right there with information, because I'm telling y'all, man, she is about some numbers. She is about, whenever something new, I mean, she's like, a trend come out with clothes, man. She own it, you know what I'm saying? With COVID.
Well, but
Hey,
it's but this issue specifically about these tests, I think is so important, because I'm gonna just raise up Chris's comment. This pandemic crisis is a transfer of wealth. I agree with that. What I always say is fear breeds consumption, and the consumption I'm talking about is consumerism. When people are afraid, they go out and try to spend money and buy things to help buffer their fear. And these COVID tests are now very expensive, almost cost prohibitive.
the
So
mask
if
too.
our government is saying we're going to send every household 4 kits, but you got to request it, I just want to make sure that people are aware of that resource. If you choose not to order them, that's your right. But the thought that somebody is going to have to pay $50 to get a at-home test right now, because that's what the market is calling for, even $20. Who can really afford that, especially if you are in a household with, like me, 4 or 5 people, and you have to test somebody, and if they're negative, the recommendation is wait another day or two and then do a follow-up test. That is cost prohibitive, but testing is an important aspect of trying to bring this to a close. So before we start, can I just say something about the testing and this
Yes.
virus specifically?
And that's what I was going to ask you about, bringing it in. What was the importance of the testing? Why are they sending the tests, 4 test kits to people's homes? Why should they order the test kits? So that's what I was going to ask you. And
Yeah. So now we've all heard about these new recommendations that have come out from the CDC, and it said, after 5 days, if you don't have symptoms, you can go back to work. You just have to mask and all of that. The problem with that recommendation is, in fact, it does look like with Omicron that the viral shedding does seem to be less time. Okay. So, but let me break it down a little bit further. So it's 5 days after you test positive. Okay. So if you test positive, chances are you have been infected for several days before that. You don't get exposed and then test positive that same day or even the next day. You got to build up enough virus. And specifically the Omicron variant looks like it doubles twice as fast even as Delta. So you likely might test positive even earlier if you have Omicron than you might have tested positive with some of the other strains. But you won't know, right? In our community in Flint and in other, major cities, we got both Delta and Omicron happening at the same time. And this
so,
was, yeah,
so real quick, right?
sure.
You was talking about the 5 days, and you were saying that Omicron sheds with, a little about 5 days, right? But by us having Omicron and Delta here, and we don't have sequencing, how do we know that, all right, I'm okay because I got Omicron? How do the people, you really can't tell which one you have?
You don't, exactly, which is why the tests are so important. If you've got at-home tests and you've got tests in your hands, then you can test yourself, and it will give you a good indication of whether or not you still have a high enough viral load that you might still be shedding virus. And again, can you imagine if the recommendation for people was go back out to another testing site? A lot of people aren't doing that. Why? Because there's such a demand on testing right now. There's a lot of wait times. Oftentimes, it takes a day or two to even get an appointment.
I saw where one shut down because of COVID. They didn't have enough staff because of COVID. But the all right, say we had a whole bunch of issues with rapid testing, and
Mm-hmm.
do the people still, if they test positive with the rapid test or the kits that they send it to you, do they still try to make an appointment to go get a PCR?
No, if your rapid test is positive, especially if we're talking about you're doing that 5 days after you tested positive, you don't need to go and get another test. You don't need to go and get another PCR test. The one issue that we'll have with these at-home tests is if people are at home testing, there we have a complicated ability to make sure that those positive cases get counted somewhere, right? So most of the numbers that you hear in community, and you've probably heard this, Art, they're an underestimate. So we now track what we call probable cases and lag cases. Probable cases would be like this: you test COVID positive. You've got 2 or 3 other members in your house. They call you to do contact tracing, and you say, I have 2 other people in my house who are showing symptoms, but they're not going out to get tested. They will be counted as probable cases. If they have symptoms and they're in a household with somebody else who's infected, likely they're positive. But there's the only way we know how to count COVID cases is through COVID testing. At-home tests are going to complicate our ability to count cases, but the value that it adds is it empowers the individual to know their status and then move accordingly. So,
So so here we go, right?
yeah.
But the way that you just presented that, and I'm constantly thinking, and you know that I'm constantly thinking on both sides. And to me, when I got word that the pandemic could be over this year, and then what you just said, it makes the numbers, it gives us those artificial numbers that, hey, COVID is gone now because you don't have no way of tracing all the positives that is being tested at home.
So this notion that the pandemic is going to be over this year, I don't know who told you that.
The
Uh,
government.
I don't know who told you. I don't know if you called up Miss Cleo or what. You got somebody with a crystal ball or reading cards or something. I don't think that's exactly accurate. Here's what I will say. The virus that causes COVID-19 is called SARS-CoV-2. It's now endemic, right?
Right.
And its older cousin was SARS, originally called SARS-CoV, now it's called SARS-CoV-1, right? Because now that we have this SARS-CoV-2, they've added a 1 to it. That was back in early 2000s. That was a much deadlier coronavirus. 1 in 10 people who contracted SARS-CoV died from it. 1 in 10. Within 2 to 3 days, people who contracted SARS-CoV-1 developed symptoms. There were no, very few documented asymptomatic cases. It made it a lot easier to identify cases, isolate people, etc. With this virus, because so many people are either asymptomatic, and especially now with this newer strain that seems to cause milder symptoms for most people, but not everybody, it is harder to get a handle on it, And so we can't say technically when the pandemic will be over because we don't know. We now got this sticky one that spreads real easy. If this mutates and somehow figures out how to be more, cause more severe symptoms, who knows how long we'll be in this. What we are trying to figure out is what will it look like for us to live with it, because it is now endemic. It's with us. The original SARS-CoV, that one just died out. That was the virus. It was nothing we did. We had no vaccine. We had none of that. It died out on its own. We actually had no documented deaths from that one in the US. We only had about 8,000 cases nationwide, and about 10% of those people died. Almost 800 people died is what was documented. This one is very different. Millions and millions of cases. We had over 30,000 deaths from this in the US in December for something that has a much lower death rate. So people being able to identify themselves as positive and not infect other people, because we don't know who will struggle with it and who won't, is really a tool that we want to make sure people have in their hands. That's why I said, all right, let's just go live, share this information with people, and make sure that people know covidtests.gov. Get your 4 free household tests, and then you have that right in your own hands.
Right. All right. So let me ask you this. Being that Omicron spreads real fast, and normally people love when something like that spreads fast because it dies off fast. How is it that you can catch it again if they say that it's going to flatline, right? But they say that you can catch it twice. How is it that, I mean, they saying it's a surge. You understand the question I'm trying to ask here?
Yeah, I do. But here's the thing, we actually don't know yet, right? Like I said, we kind of just lucked up with the SARS epidemic in the early 2000s, and it died off. This virus doesn't seem to be moving that way. We are now definitely 2 years in. That one took 2 years before it kind of died out. Like I said, no vaccine ever administered to humans. They developed vaccines, they tested it out in mice and in other primates, monkeys, etc. But some issues arose and it never made it to humans, but it died out. So could this virus die out? It could, but we can't bank on that. We don't know. The problem is, along the way, we don't want to have unnecessary illness and infection, and we definitely don't want unnecessary or preventable death from it. So we just don't know. We're learning about this particular virus in real time.
So I was reading today, and I forgot where it was, where, Hong Kong. They had to kill thousands of hamsters because of COVID risks, animal to human. Do you think that would become a problem for us?
Well, it the idea that diseases can be transmitted from humans to animals or animals to humans is not new. In fact, it's thought that the original SARS virus, SARS-CoV from the
Right.
early 2000s, they believe it also originated in a bat population.
Correct.
So absolutely, we get, you've heard of mad cow disease or foot and mouth disease. We know, in fact, there are things that can exist in animals that don't seem to make them ill or that don't cause them death. They just live with it and it's nothing. But those same diseases, if they hit the human population, our bodies don't manage them very well. Same thing happens the other way. There are diseases that humans carry that and things that we carry that we live with and we're fine, but when they get to animals, they cause a lot more death and illness. So that's not a new concept.
So I seen where Chris asked a question, and this is something that you really had, me and you had to really sit down and talk about, because I thought I had caught COVID because of the shot and our mRNA and what is it, MDNA. Can you let Chris know the difference in those two things? Because Chris, listen, I'm gonna tell you, Dr. Furr-Holden got the business, because I was ready to go down to the VA and give them the business, because I thought the virus, I thought the shot had gave me the virus. So Dr. Furr-Holden told me, that it didn't, but I was still, kind of leery. But can you tell him what the two are, Dr. Furr-Holden?
Yeah, no, it's a great question. So no, the virus the vaccines that we are using now in the U.S., the Moderna and the Pfizer vaccine, are mRNA vaccines. What though mRNA is basically genetic instructions, right? It's like a recipe, right? So your grandmama make that whatever great sweet potato praline or something, and she gives you the recipe. Now you can take it home and make it. mRNA is the recipe. It's the recipe, specifically the piece we took. Imagine if grandmama got a recipe for everything on the Thanksgiving menu. This is just the recipe for one piece of this virus called the spike protein. That is what's on the outside of the virus. The reason it's called coronavirus, it looks like a crown. Those pieces sticking up off the crown are called the spike protein. And the mRNA vaccines give our bodies the instruction on how to make the spike protein. Once your body makes the spike protein, it then will build antibodies to that spike protein. So we're only getting a little bit of instructions to build just a little piece of that. What we know changed between Omicron and Delta, and I'm just using that example, but this happens with all of these mutations, is changes happened in the virus. For Omicron specifically, a lot of changes happened on the spike protein. They estimate more than 40 different genetic mutations happened on the spike protein. What we are all looking forward to is new generation vaccines that will give us the instructions that will map onto the current strains that exist. So, no, the virus will never be included in the vaccine. That's not how the vaccines work. But as we develop vaccines that are more specific to the dominant strains, I think we'll see better effectiveness of the vaccine at preventing infection and preventing illness and death. And we'll also see changes in community and the overall, sort of strain that this is imposing on community. What we do know, though, is that booster shot still does prime up the immune system and help you build a better immune response if you become infected. It's not perfect. I'm not pretending that it's perfect. We're talking about reducing severe illness, hospitalization, and death, not preventing per se infection.
So let me ask you this. I heard you say now it's four different shots out there, right? Something a bio something, or is that Pfizer? It's bio.
It's Pfizer BioNTech is the
Okay,
same.
okay.
That's what the company
So
is.
I heard you say 2 mRNA. So what is Johnson and Johnson? I hear you say Johnson and Johnson was
That's a whole different type of vaccine technology, and I don't even believe that people are administering the J&J vaccine anymore. It's built on a different it's a different type of vaccine is the short answer.
Oh, okay.
Yeah.
Got to read up on that one then if they're not doing it anymore.
No, so I want to make sure we hit Brenda too. But
Okay.
the virus is not used in the vaccine. What it is now, we did this human genome project. We mapped the whole human genome. The mRNA vaccine technology is a little different than all of the vaccine development technology we've used in the past. All of the vaccines before this one typically used the virus in the vaccine. They would kill off some part of the virus with heat or with chemicals so that we could give it to people in a way that wouldn't make them sick, but that would give their body an opportunity to build an immune response. So that was the sort of previous vaccine technology, and it did include some form of the virus attenuated or killed off in a way that it wouldn't make you sick. These vaccines don't include the virus. They include the instructions on how to build a piece of the virus, and your body actually creates the spike protein so that you have a chance to build an immune response before you ever even become infected from it.
Now I know what Chris is asking, right? Because
Yeah.
I heard the same thing where they said that the mRNA or the vaccine was wrapped in a protein of, or the protein or shell of COVID. So I mean, I heard that also. So it was wrapped in a shell so that it can protect you or protect the message. The message is wrapped. The protein is wrapped around the message.
Not the virus. It's actually wrapped in a big fat bubble. That's what it is. It was a big fat bubble. A big fat bubble, which was sort of like the carrier, the ride.
Right.
The mRNA is not meant to live on its own. The mRNA is normally just inside of the viral molecule itself. Is just the instructions, right? It's like you go and buy some furniture at IKEA, and then inside is the instructions on how to put it together. That's what mRNA is. But it's not stable enough to travel on its own. So it was wrapped, and it is wrapped in a fat bubble just so that your body doesn't clean it up, sweep it away in a cellular cleanup process. So it was wrapped in fat, not wrapped in virus.
Okay, so I mean, now we get on to.
I feel like we in like a chemistry biology class right now.
So now here's another question then.
Yeah.
Piggybacking off that one, right? Because you said it's wrapped in a bubble.
A fat bubble.
All right, a fat bubble, right? Does this bubble ever deteriorate or leave?
Yeah, of course. If not, you have a big fat bubble in your body. Your body is constantly turning itself over and cleaning up any waste, and turning cells over every day.
So I guess
yeah, it does. And not only that, it's a good question, but you want that to be the case. You want your body to get what it needs, the instructions on how to make the spike protein, and then you want all that stuff to go away. This is a conversation I've been having with pregnant women too, who were worried, I don't want to give the vaccine to my fetus, right? Women are pregnant. And what we figured out is actually that process, it happens fast enough that it's stable enough that your body can get the mRNA out, get the instructions, make the spike protein, and then start to build antibodies to the spike protein that your body itself made. That process is fast enough that you build antibodies, and the cellular cleanup process is fast enough that if you're pregnant, the vaccine actually doesn't even cross the placenta. So you won't give your baby the vaccine, but peep this. Once your body builds those antibodies, which last much longer, you will give your fetus those antibodies. So you won't give your baby the vaccine, but you'll give your baby the antibodies. And if you can track COVID, the virus does cross the placenta. And if you are pregnant and get COVID, you could actually pass COVID to your baby in utero, in the womb.
All right. So, this is good. This is a good line of questions. I mean, not good line of questions, but a good topic or segment or whatever you want to call it right here, right? Because does this mRNA change your DNA? And if it changes and alter the DNA, does it alter the child DNA, or change up, how your child would have been compared to what your child gonna be since you took the vaccine?
So I'm gonna go back to my grandmama analogy for Thanksgiving dinner. If grandmama give you the recipe for the mac and cheese, does that change the potato salad? No, you're only getting instructions for how to build that spike protein. That's all you're getting in the vaccine. You're getting the instructions for how to build the spike protein. It's not altering your DNA. It's not giving you instructions for anything else. It's not even giving you instructions for how to create the whole virus, only to create that one piece of it. But that spike protein is so important because it is the key. The spike protein is the key that unlocks your cell and then lets the whole virus in your cell, where then your body will do the work to replicate that virus. The virus cannot replicate on its own. It needs our DNA replication process. Our bodies have the photocopier. Our body has the copy process. So if that virus cannot get into the cell and have our body do the work to have it replicate, then it won't replicate. The reason we have breakthrough infections is because especially with the Omicron strand, it's doubling so fast. It takes a minute for our body to keep pace. But the reason you have less severe symptoms is because if you're vaccinated, you won't get as much replication as if you're unvaccinated, because your immune system is already primed to do the work and fight it off before it gets in your cells and replicates. So it will do it a little bit, but not as much as if you didn't have that priming. I want to make sure we get Brenda's question too.
Okay.
So Brenda asked, and I love it. She said, "No disrespect to the doctor. Bottom line, she said several times that we just don't know. So with that being said, the governor needs to lock us down by 3 months." And honestly, Brenda, I agree with you. I feel like, and if you look at other places, and I encourage people to look this up, I won't belabor it. But if you look at what happened in Australia and some other countries where the government really did intervene, but it wasn't just the lockdown. It was the lockdown, but making sure that everybody was resourced in that lockdown, making sure that everybody had what they need. Because I'm also not in favor of just telling everybody, just stay put, don't go to work, don't go out, don't anything, because some people simply can't live that way. You can't keep the lights on if you don't have the capacity to earn income and some of those other things. So yes, some shutdown. If we had paused, the problem was we couldn't pause nationally. So literally, what if we paused in Genesee County, but not one county over? It almost made no difference. What we needed was a national lockdown and provisions so that everybody could have sheltered in place and we could have got things under control. And in the countries where they have had far fewer deaths and far fewer infections, it's because they did that at a national level. And we just simply missed that mark. So Brenda, I think you make a good point. And I agree with you. Yes, we should have locked down. And it's crazy because the numbers are worse now than they were at the peak of this when we were on a shutdown, a statewide mask mandate. And now all that stuff is gone, even though the numbers are worse. It doesn't really make sense, and it's not following the science.
So I just want the people to know that my mRNA, they sent a message when I took the vaccine, and I grew at least about 3-4 pieces of hair on top of my head, John. So I'm just joking. I'm just joking. I'm just joking. I just thought I'd throw that little joke out there because I mean, everybody, it's imperative that we hurry up and try to calm this down, because I mean, people are dying, people are sick. I read where Congressman Kildee tested positive also, and I hope he said he had mild symptoms, and I hope he get well soon.
Yeah, unfortunately, because now we are dealing with a strain that is just highly infectious. It takes so little for it to replicate and then you to become infected. And the symptoms do appear to be milder. And I'm going to just be honest, having had been a confirmed case of Omicron, and I just want to encourage people, most people will never know what strain of COVID they have. The thinking is once there's a dominant strain in your community, you just have to sort of think, yeah, that's the strain that I have. But I had Omicron and it was mild. But I'm telling you, I don't feel quite 100%. I wake up every morning on 10, fired up, ready to go. I'm on the radio every morning. I'm on Chicago Progressive Talk every morning, 7:18. My set segment is 7:18 to 7:30. Sometimes I go to 7:44, and sometimes I'm on until 9 o'clock, depending on what we're talking about. But I specifically do a health segment every day. So by the time I go on the radio, I've been up. I might have exercised, had a cup of coffee or a tea or something like that. And I go until about 7 o'clock. Then I wind it down. I make dinner for my family, all that. Since I've had COVID, I can't tell you how many times in the middle of the day I felt really tired and needed to take a nap. I don't have the same energy. Like I'm still dealing with like these weird issues around fatigue. I can function. It's not terrible, but I don't feel like 100% myself. I recovered, but I don't feel 100% myself. More than not, over the last couple weeks, I've also noticed I'll be talking about something and I'll have a particular word I want to say or a thought I want to communicate, and I might lose my thought, or I might not be able to get the word to come out of my mouth. And 5, 10 minutes later, the word will hit me. I can't say that it was because of COVID, but it's my understanding when we look at the symptoms report, a lot of people are, they talk about brain fog. I don't feel like I've got full blown, my mind ain't working right, but it does feel a little bit different than before I had COVID.
So Dr. Furr-Holden, speaking on that, right? The virus, if I'm not mistaken, takes oxygen out of your blood, doesn't it?
Say that again.
The virus takes oxygen out of your blood, right? So I see where a lot of people, that's in ICU or has to go to ICU, it says that their oxygen level drops. What is that?
Yeah, so people will have lower levels of oxygen in their blood. It's a good early warning sign of COVID. Remember, this is a virus that really seems to attack the respiratory system and the lungs. So if you're not getting good, air exchange, if your body is not able to manage that process well, your blood oxygen levels will drop. And that is not even just for people who are hospitalized. That is, oftentimes for people who are, at home. So I bought I went on, I don't want to advertise for nobody, but I went online to a large online retailer and bought a little pulse ox meter as soon as I found out that I was positive. And I also bought something called an incentive spirometer, which I can go grab, which is a little lung exerciser, just to make sure that my lung capacity was still good and I was able to take air in and push air out. And I did check my pulse ox, and it never went down substantially for me. But for some people, in fact, it does, because you're just not getting as good air exchange and your lungs aren't working as good.
So that leads up to this question right here. If your blood level or your oxygen levels are dropping and your brain needs that oxygen, could that cause some type of effect or mental effect or something in the brain?
Yeah, sure. Oxygen is like the fuel for your body. When you don't get enough oxygen, I mean, literally, if you are oxygen deprived, it can cause brain death. It's the fuel for it's the fuel. You want to make sure we get some of these questions in because we got a lot
Oh
of
yeah. All right, my fault.
yeah, I know, right? Or I know, right?
Go.
Okay, so let's see what she says here. Diane says, Diane Love. Oh, I love that name. I would like to know about being fully vaccinated. I had my second shot January 13, and am I considered fully vaccinated? I know I can't get the booster until 5 months. So they haven't officially, when I say they, CDC and, they haven't changed the definition yet of fully vaccinated. But what we're seeing increasingly is a lot of places are saying, an employer. So my employer, for example, Michigan State University, has now required a booster shot for all employees, all students by February 1st. And that is when you are booster eligible. So if you just got your last shot, your second shot in January, you should not get that booster right now as per the recommendations until 5 months out. So yes, Diane, short version is you are fully vaccinated. What we're learning is that booster shot for people who are fully vaccinated, but they were vaccinated and got that last shot more than 5 months ago, because immunity wanes, in order to get the full benefit of the imperfect vaccine. I'm gonna just keep acknowledging that, because I am not trying to shove the vaccine on people or anything like that. But to get the full benefit of it, you will need to get a booster shot, because the immunity that you get and your body develops from being vaccinated does wane over time. It does wane over time. So no, if you were vaccinated, second shot in January, you are fully vaccinated and you do not need a booster until you hit that 5 month mark.
So Dr. Furr-Holden, Daryl Robinson, it was something that I was going to ask you also, because I know somebody called and asked me this question that had COVID. And after they tested negative, about a month and a half later, they still coughing. And I was going to ask you, what are some things that a person can do with what Daryl Robinson wrote? Will my breathing ever be back normal? And also, what is it that people can do to kind of fix the coughing?
So that's an interesting question. I can't answer the question, person by person or even for the population. We don't quite fully understand why some people are dealing with these long haul COVID symptoms. What we know is the cells that COVID primarily binds to in the body, these ACE2 receptors, are in most major systems in your body. And so if you become infected, for some people, it really seems to attack the lungs or the kidneys or the liver, and people are dealing with these long term symptoms. I know lots of people who never, not never, but to date, their sense of taste and smell hasn't returned, or people who are still dealing with that lingering cough. I told you, I myself still feel like I'm dealing a bit with fatigue and not brain fog. I wouldn't say what I have rises to the level of brain fog, but I don't feel like my pistons fire quite the same all the time. And so some of the things that we do know, and this is crazy, that scientifically the causality has not been established, but for people who are unvaccinated, the vaccine does seem to help with long haul symptoms. And I will reiterate, it is so important to have a primary healthcare professional, because person by person, do you know how many people found out when they had COVID and finally saw a nurse practitioner or a physician that they also had, the beginning stages of diabetes, or they had mild hypertension and some of these other things? Having access to a primary healthcare professional to help you navigate these things is going to be the most important thing. I will never give anybody medical advice, and no physician worth having will be on a Facebook Live giving an individual medical advice. That is what you need to figure out and work through with your primary healthcare professional. And just everybody needs that. I can't stress that enough. Art, I can't hear you.
You hear me now?
I can.
Can you hear me?
Yep.
Oh, all right, my fault. Being in a city with 42% poverty, I guess we should have came on with resources that people can go to and fill out. Because I seen something where Obamacare deadline was last week or something like that. Uh, how can a person go out and get a primary care doctor? I mean, a lot of people don't. A lot of people don't know how to go out and get a primary care doctor.
That's a great question, Art. So, two things. Number one, I acknowledge that what we call affordable care, you said Obamacare, but this is the Affordable Care Act made the provision for the sort of public insurance plan that we have available now. For a lot of people, it's not actually affordable. Some of the premiums that people have to pay are several $100s a month, and it becomes cost prohibitive for people. When COVID happened, I always tell people affordable healthcare became a lot more affordable, and the premiums actually dropped, and the eligibility criteria got expanded. So you could actually make more and still be eligible and end up paying less. So I tell people affordable healthcare actually became much more affordable. So one, I encourage people to just seek that out. If you're in Genesee County, the Genesee Health Plan, it is their charge to make sure that everybody in this community has health care. That's number one. So the Genesee Health Plan, if you're in Genesee County. If you're not in Genesee County, just put in your county or your city and the word health plan. And you will likely, one of the first few hits should be your local health plan. Most communities have this, have an organization that is tasked with making sure that the residents have health care. So that's the first thing. As far as access to a primary health care provider, whether or not you're insured or not, if you are in a medically underserved community, and many of us are either in a medically underserved community or live near a medically underserved community, the provision is called a federally qualified health center. FQHC. And most communities have a federally qualified health center. We have two in Flint. Hamilton Community Health Network is the biggest one that we have here. They will provide you health care independent of your insurance status, and they will also get you connected so that you can get insurance. So if you don't have a primary health care provider, reach out to your local federally qualified health center to get that. Couple other quick questions. My girl Betty Hall Addison says, what about a second booster? Is that necessary? So those recommendations vary. There are criteria for who is eligible for that second booster shot. So is it necessary? For the people for whom it's been authorized, for many of them it is. These are oftentimes people who are immunocompromised, people who have, pre-existing health conditions, are battling with chronic illnesses. Again, the goal of the booster is to give you the maximum benefit of the vaccine. And what we've learned now, basically in real time, is that for some people, especially people who are immunocompromised, they don't build as robust of an immune response as somebody who is otherwise healthy. So the booster shot is like giving them another opportunity, their body another opportunity to build an immune response in the absence of infection. The whole goal with the vaccine is to get your body primed to respond without you being infected and before you become infected. So the second booster shot for the people who are eligible will increase the body's immune response and also provide additional protection if they do become infected and reduce the chances that they'll have severe illness or death. Can't hear you, Art.
Diane Love put something else up too, where I do have a compromise.
Yeah, but again, this is why it's so important to have that conversation with your primary healthcare provider. I literally have a good friend and a colleague who has lupus, and she was scheduled to receive a second booster shot today. And she had a lupus flare up, and she ended up going to the hospital. She was released within a day, and then she had to follow up with one of her medical providers and say, should I get this booster or not? And the recommendation was no, because you're dealing with this specific immune response right now in relation to your lupus. No, I do not want you to get the booster right now because we don't want to overexcite your immune system. So they're just going to keep monitoring her, and her healthcare provider will figure out when it makes sense for her to get her second booster shot. But again, that's why you need a primary healthcare provider to help you navigate that stuff. This is not the kind of stuff you want to figure out on your own or get recommendations from a website or even a conversation like this. If you have any kind of pre-existing health conditions, especially one that impacts your immune system, you've got to navigate and negotiate that with your healthcare provider. Oh, last thing, real quick, I want to say about that. Oh, yeah. What's cool too is because I asked her, how many doctors do you have? She said, I have 6 doctors that I deal with on a regular basis. 6 doctors are helping to manage her lupus because it triggers different things at different times. You want a specialist. You want somebody who is steeped in your health, who understands what you are dealing with to help you figure out when is the right time for you to get vaccinated and when is the right time for you to get your booster shot. Can't hear you again, Art. Still can't. What are you hitting? Mute? Unmute yourself.
Oh.
You just keep hitting mute. That's okay.
I don't know how I hit that. My fault. Hey, my thing, everybody, listen. And this is coming straight from the heart. Straight from the heart, man. And I'm not trying to tell you what to do. I'm serious, I'm not. I know you are worried about the vaccination shot. I know you don't, you kind of leery on it. But listen, everybody's talking about it's experimental drug. It's this, it's that. But guess what? You got a lot of people that's showing you that you could survive it. But it's a lot of people showing you also that, without it, you're going to get the experimental drug up in the hospital, laying on your back, and you don't have any say so. At least you do have a say so when you take this vaccination shot. I'm just saying, hey, Miss Golden is realer than real. I mean, my three granddaughters had it. My friend died. About 4, 5 friends died last week from it.
Yeah.
It's serious, y'all. I went out today and I'm wearing my mask. I mean, at first before Omicron, I take a chance I wouldn't wear it, but now I'm wearing it. It won't. It's people say, oh, it won't prevent you from getting it. Well, if you put yours on, it will. You see, I'm doing my part and trying to stop it from spreading. You do yours. By you putting it on, people try to argue, oh, the mask doesn't protect you. It just stops you from spreading it. Genius. That's what we're trying to do, genius.
Well, it's an additive effect, though. And this is what I want people to understand about the mask, right? The masks do provide some protection from you contracting COVID. They do provide some protection. The real power in the mask is when everybody has one on.
Right.
Right. So it really is good at stopping you from breathing out your COVID and potentially infecting others. And it does still provide some protection from you potentially breathing, COVID in. The thing I want to really remind people, COVID comes into your body through 3 primary routes: your eyes, your nose, and your mouth. The mask should cover your nose and down to your chin. So if you've got that covered and it's well fitted, you've protected those 2, pathways, right? Eyes, you just got to keep your hands out of your face. The problem for a lot of people is that they don't have a mask that has proper filtration. And now we've had to upgrade the recommendations a little bit because Omicron, it just takes so little of it for you to become infected that you need a mask that's well fitted and you need a mask that has multiple layers of filtration. That's where all the hubbub around the N95 and the KN95s came from. And they're expensive, and I understand that. A surgical mask is still fine, but you will have to layer it. Your cloth mask is still fine, but you will have to layer it. They're just not sufficient, and you need to make sure that it's well fitted. You need to put it on properly and take it off properly. One of the biggest things that I see people do, which just still makes my skin crawl, is they will take their mask and pull it down their neck. So you're out. Let's say you're around other people who are unmasked or whatever. And remember, this is spread through the air, through droplets. So you might have been exposed, but you had your mask on, so you didn't breathe it in. But that doesn't mean you weren't exposed. So if you were exposed and it was around you, where would it be? It would be here. It would be here. And what do you do when you pull that mask down to your neck? Whatever is on your neck, you just put on the inside of the mask. And then what happens when you pull the mask back up? You then pull that right back over your nose.
All right. So here's something that I don't hear much of anymore. Yeah. Say I walked into the place, somebody sneezed or something like that, right? Does it stick to your clothes? Does it? I mean, you don't hear where people be saying, well, it lasts on a countertop for this many minutes or this many hours. It lasts in the air. How long does Omicron last in the air?
I don't have the answer to that. I don't have the answer to that. I just don't.
And that's what I mean.
Yeah, I don't have the answer to that. But here's what we do know. What I can answer. We need good air exchange. And Chris asked this question about what about plants that detox the air? I can't speak to that either. I won't ever feign expertise where I don't have it. Here's what I can speak to. We know that good air exchange helps tremendously. Here's what I mean when I say air exchange. this is the big concern with, large indoor gatherings. The air quality is what it is. When we say air exchange, we're talking about taking air that's inside and it going out, and fresh air outside coming in. You will hear people talk about air handling systems and how we needed to update them, for example, in the schools, right? Because we have a lot of schools where the windows are painted shut. Old school buildings, old houses, people paint and they will paint the windows shut. The windows will have those old sashes and they're broken. So you might put a window up, but if you don't put a 2x4 something in there, it might come crashing down and create other kinds of harm.
So why are you talking about my windows?
I know, right? Listen, I lived in a big old house in Baltimore and I had 27 front facing windows, and it took me 3 years to replace them because windows is expensive.
Yeah.
Right?
Right.
So air exchange is really what we want. We want to get old air out and new fresh air in. And so you can do that in a couple of ways, right? That's why they say open windows, that, and I actually will open up the bottom on some windows and the top on other windows, just so I got air moving. Right. I have a central, AC and heating system. The compressor that you have outside is pulling air from the outside, pumping that in, and it's also pushing air out. So, those things are like what we need. You need good air exchange. Some of the ways people are trying to do it are with these small air filters and purifiers. My only thing, again, going back to my point, that fear breeds consumption. I would not encourage people to go out and start spending a whole lot of money on air purifiers. We need more data to understand how well those things are working. What we do know is, and this was just literally, this old school stuff. Remember when you ever had like burnt something on the stove? The real knowledgeable people, they will put the ceiling, the floor fan up. They will put that fan in the window and have the air blowing out.
Right.
Why? Because that blows the smoke out. And if you've ever had this happen, you see it, and a real G knows how to do that. The younger people will have it turn the fan on and face it inward, and the smoke just be blowing around.
No, what they're gonna do?
Will put it in the window and have the air blowing out.
Right. Hey, what the young people gonna do is put it on the other side of the door and the window over on this side, and they're gonna try to blow the smoke throughout the window instead of just putting the fan in the window and pulling the air out. So
yeah. Brenda makes a good point. She said she had a doctor appointment yesterday, and all the doctors had on a blue mask. I'm just at a loss, doctor. It's because, Brenda, we ain't all drinking the same Kool-Aid we serving, and I know it's very, very confusing. And I'm just sorry. I'm deeply disheartened by a lot of the behavior of some of my colleagues, both in public health and in medicine and just in the healthcare sector generally. People just are not, and you got to remember, behind those masks and behind those initials, many of our healthcare providers are still human beings and regular people, and people are just doing what they're doing, not necessarily doing what we know is the best as far as preventing spread of infection. A part of me feels like, honestly, the CDC reduction in the recommendations from 10 days to 5 days has actually made it safe for a lot of healthcare workers to get tested. Because in a lot of places, they weren't even testing the healthcare workers. And people know, they were like, I know I got COVID, but my boss told me I got to come to work. And I always tell people, not testing and not getting a test ain't going to change your COVID status. That's the silliest thing I've ever heard of. But in fact, it's true. A lot of folks still are not, and even in the health space, are not following the very same recommendations that are being put forward by their national societies, by the CDC, and just the health and scientific community in general. That's why I think, and that's why I do this and take the time, even though I'm tired. When I tell you, Art Woodson, I'm tired. But I had to make sure that people know you can get these 4 free tests now. I don't know how long they're going to be available. They made them available a day earlier than they said they would. And I don't want anybody in my world, anybody that I could impact, to miss that opportunity. Right. So I'm just reminding people, go www.covidtest.gov. Get your 4 free tests. You can get up to 4 per household. And I just want people to do that and have that additional tool in their belt, because again, it's about having all the tools, and I know that we don't talk a lot about um, diet, nutrition, some of these other very robust and important measures for people's health. And I tell people, it's not that I don't think those things are important. And I have a lot of practices that I do in my own life, but when I'm in these kinds of spaces, I don't put those things forward. Why? Because I do believe people need to listen to experts in the right area. I'm not a nutritionist. I'm not an herbalist. I could talk about those things from my own personal experience, but that's what I do on my family Zoom, my family chats. That's what I do with my friends one on one. I would never take a platform like this and pretend to have expertise in things that I don't. But I am willing to have one on one conversations with people about the prevention practices I use in my house and the other kinds of transformations that we've done around our nutrition and our eating and our physical activity practices that I know have made a big difference for my family. I just try to stick to what I can speak to with authority in these spaces and encourage people, if you want more around some of these other important measures, talk to experts on it. There are people out here who are doing work very similar to what we're doing, but specifically focusing on things like nutrition and plant biology and stuff like that. And I let those people lead those conversations, and I integrate that stuff in my life. But I don't talk about it because it ain't my expertise.
And I guess, yeah, I heard that. I heard that. I it's not my expertise neither, y'all. I just like to ask questions and read and share and try to get the information out to the people. And it's all about knowing your lane. And my lane is to try to bring people that know and share with everybody. So that's my lane, everybody. I don't profess to be no expert, but I'm an
Yeah.
expert on getting information out there because this is Hood News Network.
I know,
Um,
right? Watch it. And your boy Chris. Chris, I will never run for public office. Never. I could serve the people doing this, because what I've seen from some of our elected officials, and don't get me wrong, we need them. I will never be muzzled. I'm always going to speak my truth. I'm going to say what I want to say, how I want to say it, when I want to say it. I'll have no problem saying, oop, I made a mistake, or that was wrong, or I've had a change of heart. Because for people who knew me early on in this pandemic, early on, remember, I was not, people said, you getting the vaccine? I said, not right now. I wasn't even eligible. I didn't have an opportunity. I said, no, not right now. I need more information. I'm not comfortable yet. And about a month later, I had a chance to take the vaccine. And I was like, I literally was a head snarl. And then when I got the opportunity to take it, I had to do some real grappling and soul searching. And I took a lot of my concerns with me when I got my first dose. So much so that my second appointment got canceled because we moved into a scarcity phase. And I went hamtastic. I said, I didn't take this plunge and get one dose to get half of a vaccine. So I became a real advocate for myself to get that second dose. But I had concerns too, just like other people, and I'm honest about that stuff. And I can respect people who are a no. I just want people, if you're going to be a no, let it be for fact, not fiction. Let it be a real choice that you made after you weighed out the facts, after you talked it through with your family, with your partner and spouse and your loved ones and your primary healthcare provider. It just really doesn't settle right in my spirit that people have so much misinformation, and that misinformation and all of the bad messaging that's come from our government and these federal agencies that are supposed to empower us around our health are the things that are fueling people to be a no. Because again, you hear the stories from people who've been infected and they wish they would have done something different. So that's why I'm here.
See, and I was a no, and then I was like, man, I am not taking that shot. Period, point blank. It hadn't been tested. I don't care. I wait until everybody else take it. I'm not taking it. And I just sat back and thought about it. I was like, man, wait a minute. In the military, they shot us up, man. I mean, we stand in a line and they shooting us up with everything and anything.
Yeah.
And to this day, I do not know what they injected in me.
Yeah.
So I was like, man, you know what? If I took it in the military, I could go and take it now.
Yeah.
And I'm still here, everybody. I'm still here getting on people's nerves.
Lord, are you
Uh,
ever? And I gotta go, Art. We said 1
no,
hour.
no.
Brenda already then gave us the wink and the nod. She said, stay safe, stay blessed. I'm going to hibernate in my bed and thank
Yep.
you. So we want people to know we come on, it's going to be an hour. They're going
Yes,
to do
ma'am.
the best that we can. Chris said, let's have a family chat and all that. You know what would happen, Chris, if I really laid my guard all the way down? I would say something and somebody would pick up that one snippet that I didn't have no science for, and that would be the thing that would go viral to discredit me. So family chats have to be family chats. But ask anybody in this community. It's a lot of people in this community. I got two communities. I got Baltimore and DC, and then I've got Flint and Genesee County. Y'all both got my heart. Flint got my butt. Like I'm sitting in Flint, but I'm from the DC area originally, and I spent a lot of time in Baltimore. People Facebook message me, people text me. I always make time for people, and I'm willing to have those conversations. It's not efficient for me to do them all one-on-one, but if it will make a difference for somebody, I always find the time to do it. And I've been very good at connecting people to other people like me in their local community to help them navigate. Art, and I just want to shout you out and acknowledge you before we wrap up, because who you've been for this community. You are a John R. Lewis, good trouble maker.
Oh, thank you.
And I really acknowledge and appreciate your authenticity, which is why I'm willing to roll with you, more than not, because you've been very honest about your own experience and your own journey. And that's what makes people credible. I ask people, yeah, I have credentials and I've got background and I am researching constantly, but I also really stand in my own truth. And I do my best to try to speak the truth and the science as I know it and as I understand it.
And I thank you, Doc, for bringing the real. You being real with everybody. Just you saying, that you was a hard no at first also, and that you wanted to check it out before you even get a shot. That lets the people know that, hey, this Doc is real. She gonna tell you like it is, and that's that. So, hey, y'all, I held Doc up for about 7-8 minutes over, and
I know,
I really
my computer
apologize. I really apologize, but when it's fun, you just lose track of time. I'm so sorry, Doc. So sorry.
No, we good to go. So last word to people, and then Art, you take the last word. I just want to remind
I'm done. Yours the last word.
Get your free test if you haven't done it. Don't delay. Just do it now. Get your 4 free test kits for your household. I went online. I ordered 4 for my household, and I have 2 of my children have moved out of the house. I ordered for them and let them know, hey guys, I ordered yours, so don't go in and double order and all of that. So that's the thing. Get your 4 free rapid at home kits for those people. I see Althea say I got mines, just did mines. Please do it. www.covidtests.gov. Get your free kits. I think it's gonna end up being a $200 kit from the government.
Yeah, it's in the chat too, y'all. So
yep.
Up under my name. It's up, it's in the chat. I'm gonna holler at y'all later. I'll be back. No, I don't know when, but we'll be back. I'll be back.
Yeah.
Hey, MICKEY.
Thanks, Art.
All right. See you later. Bye-bye.